welcome you all to We Talk to You, a show by Puberty to Menopause, a public health awareness initiative of Human Biological Institute. Human Biologicals Limited is an initiative of Indian Immunological Limited. IL was first established by National Dairy Development Board in 1982 as its unit and later registered as company in 1999 with the name Indian Immunologicals Limited. HBI was established in the year 1998 when the Government of India requested IL to produce a modern tissue culture anti-rabies vaccine to phase out the unsafe nerve tissue vaccine. The first manufacturing facility of HBI was established at Uti. The facility is one of its kind in India to have rolled out first Vero cell culture rabies vaccine in 2000. Subsequently, HBI launched other vaccines and currently we are the major player in human vaccines. We are leader in ARV segment and present in around 60 countries. We have a 3 state-of-art manufacturing facilities at Uti, Gachibowli, Kirkapatla, Genome Valley, Hyderabad. HBI has forayed into markets of clinically proven wellness products and infertility range of hormones. Our vision is shaping global healthcare by spearheading the One Health initiative. Mission is to innovate, produce, and market quality healthcare products and service to improve and extend lives. Our values: we believe in providing affordable products with high quality through continuous technical innovations and improvements to meet our customer needs. As a corporate social responsibility, we have adopted schools where IL is providing infrastructure and basic facilities, including in helping midday meal program. In association with NDDB through our gift milk program, hundreds of school-going children are benefited daily. We also have donated oxygen generation plant to Telangana Institute of Medical Science, Gachibowli, Hyderabad. These are few information about Indian Immunological Limited. For more information, you can also log on to www.indieimmune.com. Puberty to Menopause is yet another initiative of HBI, where we talk about everything and anything about women's health. Today's We Talk Do You show is dedicated to yet another very important topic, importance of TD vaccine in pregnancy. Today we have Dr. Surangana Agarwal. Dr. Surangana Agarwal is a distinguished gynecologist and obstetrician with a vast clinical experience over 10 years. She is a gold medalist in MBBS from Mahatma Gandhi Medical College, Indore. She is a postgraduate from Government Medical College, Nagpur, and she achieved a DNB from Ascot Fortis, Faridabad, and fellowship in laparoscopy from BEAMS Hospital, Mumbai. Ma'am is currently working as a consultant in Ma Saraswati Hospital, Jaisinghpura, Mathura, UP, and Riti Siddhi Polyclinic, Shankar Vihar, Mathura, UP. Hello, ma'am. Most welcome, Dr. Surangana Agarwal. Thank you so much for being us with We Talk Do You show today.
Thank you.
Ma'am, let's start our show by a few common questions on today's topic, that is importance of TD vaccine in
Sure.
pregnancy. So, ma'am, like our first question for the in today's interview, ma'am, what is immunization or vaccine, and what is the different immunizations or vaccines given in the pregnancy?
So immunization basically is a immunity which the body gains. Vaccination is the technique which provides immunization against a particular disease in a person. So immunization is the result of a vaccination. So there are various vaccines which can be given, which are live vaccines or attenuated vaccines or toxoid vaccines, which we can say. So considering pregnancy into our point of view, so in pregnancy we have certain vaccines which are advisable and certain vaccines which are not advisable. So the most common which we all know is the tetanus vaccine. टीकाकरण जो उसको बोलते हैं कि प्रेगनेंसी में एवरी ऑल द फीमेल्स आर अवेयर ऑल्सो एंड दे आर लाइक कि हमारे को टीका नहीं लगा. So earlier the government
जी.
which used to be advising was the only the tetanus toxoid, which provides immunity against only the Clostridium tetani. But according to the recent schedules and
Yes.
recent studies, they have upgraded it to the Tdap vaccine. Besides this, other vaccine is the flu vaccine, which can be given annually to the person who is more susceptible to the influenza vaccine. Besides influenza, besides this, there is respiratory syncytial vaccine, which is usually not advisable, similar to flu vaccine. And during the corona outbreak, we had the COVID-19 vaccine, which was also advisable to the pregnant as well as the lactating mothers. So these are all can be given safely to the pregnant female. But there are certain live vaccines like the varicella vaccines, which are not advisable and should not be given to the pregnant female.
Thank you, ma'am. Thank you for saying the list of vaccines. What are important vaccines in the pregnancy, ma'am? As the today's topic is on TD vaccine, ma'am, what is TD, ma'am? Like, what is the full form of TD, and how do you define the TD?
So TD, it stands for tetanus, toxoid, and diphtheria. So basically, it provides immunity against diphtheria. It is a serious bacterial infection and against tetany, tetanus, which is caused by hello,
Yes, sir. Yes, ma'am. You're audible, ma'am.
again caused by serious bacterial infection, which is caused by Clostridium tetani. So these two deadly bacterial infections can be prevented uh, in childhood, adulthood, young persons, and even in pregnancy. So basically, TD stands for both of these things.
Okay. Like as you mentioned, the TD can be tetanus and diphtheria diseases can be prevented by the vaccine and given to the all ages. Like, ma'am, like how a person will be knowing to when to take a TD vaccine, and how does it spread? Like, and what are the most common symptoms of this tetanus and diphtheria?
So diphtheria, as I said, it is a serious bacterial infection and it is caused by a bacteria known as Corynebacterium diphtheria. So basically, it's an airborne disease, and basically, it is the bacteria resides in the farm animals or the poultry animals, and the humans contact get them these infections through a airborne infection, or we get contact with these animals. So what this bacteria do is they get into our body and they release a toxin which is known as diphtheria toxin, and it forms a layer in our throat, in our nasal membrane, in our above our vocal cords. So it forms a grayish membrane above our tonsils. So the patient what comes up to us with the symptoms of difficulty in breathing, hoarseness of voice, fever, malaise, or sore throat, and difficulty in swallowing. So basically, the patients with diphtheria has these complaints, and uh, basically we come get to know either through the symptoms, or we have certain
Okay.
laboratory tests which detects certain PCR tests which detect these toxins, and then accordingly, then we can provide the antibiotics, and the necessary immunization schedule can be advised.
Okay. Okay. Thank you, ma'am. Thank you for saying this
And
symptoms and all.
also about the tetanus, I'll talk. So tetanus is basically caused by Clostridium tetani, which is again a serious bacterial infection, and usually this bacteria resides in the soil, feces, or the rusty objects. है ना? So whenever the
True.
person gets infected or gets traumatized, so this bacteria tends to go and store themselves in the wound. So wound is a basically low
Yes.
oxygen environment. So they multiply themselves
Okay.
there and releases a toxin which is known as tetanospasmin. So this spasmin toxin get deposited in various parts of the body, like most commonly in the neck muscles, back muscles, and chest, abdomen, causing a serious condition in which if it occurs in the back, so the posture of the body is changed. The person cannot lie down straight. There's opisthotonus, so there is a curvy body texture. Also, if there is in the neck, the patient is unable to swallow, and there's difficulty in breathing, and most of these cases turn up to be fatal and the person dies. Otherwise, there is no treatment for tetanus. So whenever the person gets hurt,
Yes.
we ask them to take a tetanus injection immediately, because there is no treatment to this. There's only a prevention, which is through a vaccination.
Vaccination. Thank you, ma'am. With your clinical experience, if a person or audience has a doubt that if a person gets a tetanus or diphtheria during pregnancy, like what are the conditions or what are the symptoms seen during the pregnancy, ma'am?
Symptoms and conditions are almost similar. So basically, so that the pregnant female doesn't get these symptoms, we advise them to take the Tdap vaccination as soon, mostly in the 27 to 36 weeks of the pregnancy. But if the female is unaware, we ask them to take plain tetanus toxoid also. So the female should be given this first dose as soon as they come in contact with the healthcare professional, as advised by WHO and other government organizations. But usually it is advisable at around 14 to 16 weeks first dose, and the second dose can be given around 24 to 28 weeks of gestation.
Okay. Ma'am, as you mentioned, the first dose, the TT can be given. So, what is the difference between TT vaccine and the TD vaccine, ma'am?
So TT vaccine, as the name suggests, it is just the tetanus toxoid. It is going to give you protection against only Clostridium tetani, whereas the TD vaccine gives you protection against the tetanus toxoid, tetanus Clostridium tetani, as well as diphtheria, Corynebacterium diphtheria. So it is usually advisable from 27 to 36 weeks, because the antibody formation from in the mother is maximum during the last trimester, and which can be transmitted passively to the baby, and the baby can also acquire some kind of immunity from the mother during pregnancy, and which can work later on, because when the baby is given vaccination during the initial neonatal time, so the effect of that vaccination takes at least 2 months to be effective in the baby. So during that duration, it is the mother antibodies or the passive immunity which protects the baby against these infections.
Okay, ma'am. TD is more recommended than TT because it gives additional
Yes.
passive,
Yes.
okay. Thank you for saying this, ma'am. Ma'am, who should receive the TD vaccine and what is the recommended schedule?
CTD vaccine can be offered to any children besides their childhood immunization, which is given to 7 years or above, and adulthood also, and the young adults also. So there is a booster dose which should be given every 10 years. And besides the initial childhood dose that they have received, and in the pregnant female, they are usually advisable around 27 to 35 weeks of gestation.
Okay. My next question is ma'am, as you explained very clearly to our audience that it's the difference between TT and TD, and you also mentioned about Tdap, ma'am. What is the difference between a Tdap and TD?
So TD is protection against the two bacterial infections, which is Clostridium tetani and diphtheria. So the Tdap basically gives protection against three bacterial infections. The third one is the pertussis or the whooping cough, which we call. So it is basically it is required in the neonates. because it has a nature that it causes such kind of a cough that the patient has a sound of a whoop. So the patient has three stages, like paroxysmal stage, then there is convalescent stage. So it provides protection against the pertussis also. So it has a acellular component of the pertussis. So that's why it includes the tetanus, the diphtheria, and the pertussis. The three diseases it provides protection against.
Ma'am, how common is pertussis in India, ma'am? Like, is the pertussis doses should be included in the vaccination?
So pertussis is basically common in the young neonates, newborns, and basically its immunity is attained by 2 months, as I told earlier. So giving the Tdap vaccine is more preferable in the pregnant females, so that the passive immunity which is being transferred from the mother to the child can be worked in the neonate and to up to 2 months. And also every care worker who is going to be close to the neonate, like the person who is going to take care of the baby, newborn baby, or the mother, and anyone in the family, if they have not received this vaccination, they should also receive Tdap vaccination once in their lifetime, and it gives a lifetime immunity or against the disease.
Okay, ma'am. Thank you for explaining it so well, ma'am. Ma'am, now my next question is like any person nowadays, everyone has this doubt. They have a cut or injury, they get a injection that is TT or TD. So, how a person should like get a suggestion, like sometimes they have a doubt, the market has TD and the market has TT also, like which injection they have to take.
TD is preferable, but if it is not available, since it's little costly, not very much, but little costly than the tetanus toxoid, and if their pocket doesn't allow them, then they can go for tetanus toxoid also, just the plain TT injections. But the primary care involves the wound washing and proper medications at the local wound, so that the bacteria, if any way transferred to the wound, does not reside there and just get washed off through the normal primary medical care. So they should not worry, and they
Thank you,
should
ma'am.
I think now the people are themselves so much aware that they go and take a TT injection without a prescription from a medical health professional.
Yes, very well and truly said, ma'am. Ma'am, our next question is any like when the mother or the pregnant woman wants to get an injection, she always have a doubt or misconception, like is a vaccine safe for me? So, what is a note for the mothers on vaccines, ma'am?
So yes, they should be concerned about, because there are various kind of vaccines, like there are live vaccines which I told earlier, and there are just the toxoids which contains the components from the live viruses which are dead or attenuated. So they should be well informed that these vaccines which is offered to them, that is the tetanus vaccine or the TD vaccine or the Tdap vaccines, they are inactive vaccines and can be given safely to the mother. They not only provide immunity to them, but to the baby and the newborn which is going to be born, and up to few months when the actual vaccination of the baby is going to work in the body, and they don't need to worry about it because they're not live vaccines.
Thank you, ma'am. Thank you for saying this one. Our next question is like, as you mentioned, like all the vaccines are safe. TD vaccine is safe. Tdap and all vaccines are safe. Ma'am, can diphtheria and tetanus antibodies from the mother pass to the baby, providing protection after birth?
Yes, of course. They do pass during, so that's why we are prescribing them during the late trimester, that is the third trimester, 27 to 36 weeks. So the antibodies formed in the mother provides protection through passive immunity. They passes through the placenta to the baby and provides the immunity to the baby, as well as during in the womb, as well as when the baby is born in the outside birth and is exposed to these bacterial infections, the immunity is still there in the baby and they can be prevented against all these diseases.
Like our last question of today's interview, ma'am, like according to WHO, many countries have shifted from TT to TD. Like, what is your suggestion regarding this, ma'am?
Yes, according to WHO, many countries have shifted to TT to TD, and this is a very good move from every healthcare professional, so that we can cover most of our population and be make them free from these dreadful uh, infections which are easily encountered unknowingly by them. And also the pregnant females who make like a big chunk of any country and are the growing persons because they are giving like live births. So it is necessary and it is the need and also the requirement of the country to provide protection against these diseases to those also. So yes, we should definitely uh, shift our view from plain TT to TT.
Thank you, ma'am. Thank you for suggesting this. Ma'am, like as the world is celebrating the World Immunization Week, this week is a World Immunization Week. What is your take-home message to our audience, ma'am?
So my take-home message is like to all the pregnant females. My message would be like you should not worry about the type of vaccines you are receiving. Just you need to consult your doctor and know about the vaccine and its importance in pregnancy and to your baby. What are the benefits they are going to cause to you? So basically, the first dose of the tetanus TD vaccine is given around 16 weeks. So second dose is given around 27 to 36 weeks. If the Tdap vaccine is available in your hospital, that would be a better preference. But if not, TD is also a good option available for you. Besides this, you can also go for a flu vaccine, which is also offered around 27 to 36 weeks of gestation, so that you can be prevented against influenza viruses and all. Besides this, any other information regarding the vaccine should be collectively collected from your doctor and healthcare professional without taking a worry in your mind that this is going to cause some disease to your baby or to your child.
Thank you so much, ma'am. Thank you so much for giving us this time, your valuable time to me and to our audience, watching us today. Thank you so much, Dr. Surangana Agarwal, ma'am. Thank you so much. I'm sure that whoever is watching this video now and would be watching in the future will get benefited with all the suggestions and insights given us today by ma'am. Thank you so much for joining us, ma'am, today.
Thank you so much.
It was my pleasure hosting ma'am today when we talk to you. With this, I would request all the viewers to follow us to pubertytomenopause.com and in all our social media platforms. And if you feel and want to bring us such kind of topics, please do write us on pubertytomenopause.com. We will come to you and with more such series with our leading healthcare experts or from all over India. Thank you so much for joining us today. Thank you so much, Dr. Surangana Agarwal.